Everyone, welcome to the channel, and today I am going to discuss the first case which comes under clinical reasoning. Before I start the case discussion, please note that this discussion is only for academic purposes and it is not intended for direct care of the patients. Consult a physician whenever needed. So let us start the discussion. You all must have seen the detailed case scenario in the Telegram group. I am just putting up the summary of it. The clinical details are: it's a known cocaine abuse user who is a middle-aged male. He was behaving abnormally and had spontaneously controlled seizure of 2 minutes duration. Now he is agitated now, has high blood pressure, tachycardia and also tachypnea. The question is, which drug is helpful initially in management of this patient? Before I go on to discuss the options, let me tell you the clinical diagnosis in this case is: it is a case of acute cocaine intoxication. It's a case of acute cocaine intoxication. So basically the question is about, in a patient having acute cocaine intoxication, which drug is helpful initially in the management? The options given are A. Haloperidol, B. Lorazepam, C. Phenytoin and D. Propranolol. Before I tell you the answer, let us have a brief discussion about the acute cocaine intoxication, the topic for the day. As most of you must be knowing, cocaine is a drug of substance abuse. It's a recreational drug. It is commonly snorted or inhaled as a smoke or dissolved and injected into a vein. Once the cocaine is entering into the body, it can have detrimental effects, and the two most important organ affected is what I have shown in the picture. One is the heart, the other one is in the brain. First, let us discuss about the problems it is going to cause in the heart. Please note for your exams, cocaine is a sympathomimetic agent. Cocaine acts as a sympathomimetic agent. How it does this? It basically blocks the uptake of norepinephrine as well as dopamine, thereby increasing their levels and thereby causing a sympathomimetic effect. Okay. Now in the heart, what are the problems it is going to cause? You all know that sympathetic stimulation of the heart is going to result in tachycardia, that is increase in the heart rate, hypertension, increase in the blood pressure as well, and also in severe cases it can even precipitate myocardial infarction and even death have occurred because of this. In the brain, please make a note of this. Cocaine is one of the very important stimulants of the brain. That is why these patients always have the following features, which includes agitated behavior, paranoid behavior. These patients even can have hallucinations. And please remember, cocaine has a tendency to decrease the threshold for seizures, and that is why easily these patients can develop seizures as described in our particular question. These are the effects of acute cocaine intoxication. Now coming back to the question was asking about which drug is going to be helpful in management of a patient with acute cocaine intoxication. Let me take you back to the options. You can see the options here. Which one do you think is the answer? Anybody? Yes? Okay. I think most of you must have guessed the answer by this time. Any patient with acute cocaine intoxication, the first important point is sedation of the patient. And sedation is typically achieved by a benzodiazepine, and in the example it is lorazepam. I do agree that haloperidol can be given to control all that stimulation and paranoid behavior in this patient, but haloperidol is not for acute management. It is only after stabilization of the patient. In the acute phase, always remember lorazepam is the one which is going to be used. Now please remember, in case of cocaine intoxication, the seizure is precipitated due to the effect of cocaine. And in any case of drug-induced seizure, phenytoin is not useful as an anti-epileptic. In case of drug-induced seizure, like cocaine-induced seizure, phenytoin is definitely not going to be helpful in the management of seizures. What is this problem with using propranolol? Propranolol can control the heart rate and all, no? Then why are you not using propranolol? Please remember, propranolol, because it causes beta blockade, it can cause uncontrolled or unopposed alpha stimulation, which is actually going to be very, very dangerous in this particular scenario. So that is why propranolol should be avoided. Please make a note of this. This uncontrolled alpha adrenergic stimulation can cause lethal hypertension and death of these patients. So that is why propranolol should be avoided. So by ruling out all the options, the answer for this particular question is lorazepam, which is the initial drug in the management of acute cocaine intoxication. Okay. So thank you for listening. If you have enjoyed this video, like this. If you have any queries, please enter in the comment section. Don't forget to subscribe to this channel and share with your friends also. Thank you. We'll see you in the next clinical case scenario.